Best practices, we heard the president say, as it relates to schools, that he wants to see schools open, but maybe teachers who are older than 60 not necessarily come back into the classroom. When you talk about reopening the economy, reopening the country again, there's a lot of people out there wondering, well, my school-aged child, should they come back into contact with a family member who might be older than 60 per se? What is the White House advice on that and families who are all over the country saying, is it time to meet up again?
Well, the president and the task force have been clear that vulnerable Americans, our senior citizens, need to shelter in place, and they need to take extra measures of precaution because, as we know, they've been disproportionately affected by the coronavirus. So I certainly would include the senior community to continue to follow the guidelines we've put forward. Yes.
Thank you. Dr. Birx has mentioned an influx of asymptomatic coronavirus cases. Without more widespread testing, how do you get a handle on something like that, and how do you keep people without symptoms from spreading the disease around the country?
Yeah, so it's an important question. We get information on asymptomatic spread when we test in the meat processing facilities and other facilities. Again, we can just test strategically, and it's important that once we test and we find an example of someone who has coronavirus, that we can contact trace and ensure that it's not spread to other members of the community. So contact tracing is an important measure, and we're testing strategically and in line with governors. John.
What's the process, Kaylee, for the distribution and access to remdesivir?
Yeah, remdesivir is a great example of innovation in this country. I would note that remdesivir is a drug that the president mentioned quite often, and as it turns out, there's a lot of hope and a lot of promise when it comes to remdesivir. Gilead chairman announced last week, and CEO Daniel O'Day announced that they would be donating 1.5 million vials of remdesivir and working with the federal government to distribute to patients across the nation. So this will get out there, and we thank Gilead for the great work they've done and for giving these 1.5 million vials, which will help a lot of Americans around the country.
But what's the process for distributing it and giving access to patients?
I don't have any information on that as of now, but once I get that, I can share that with you. Yes. Jack.
Thanks, Kaylee. The president said yesterday he does not want Dr. Fauci testifying before the House because it's filled with Trump haters. How is that consistent with oversight and transparency?
Well, first of all, what the president noted was specific to the House. It's important to note that Dr. Fauci will be testifying before the Senate, which means he will be fielding questions from both Democrats and Republicans. The House, however, and specifically Chairwoman Nita Lowey's committee, did not act in good faith. Mark Meadows had 3 calls with Chairwoman Nita Lowey 3 nights ago when she called to ask if Dr. Fauci could testify before a subcommittee hearing, and Chief of Staff Mark Meadows has made clear he wants to make the best use he can of the task force members' time. Of course, they're working hard to save American lives, so that's very important. So to that end, he said in the 3 phone calls, what is the purpose of this hearing? Can you give me the subject matter? And Lowey was unable to tell the Chief of Staff what the subject matter was. The last phone call they had was at 10:46 p.m. on that evening, and Lowey agreed to follow up in the morning with details. Those details were never received. Instead, we got a press release. So that's what we call a publicity stunt. We encourage the House to act in good faith, much like the Senate did. And as I noted, Dr. Fauci will be speaking in a week and a half before the Senate, so the notion that he's being blocked is just farcical.
Let me ask you just one other topic?
Someone I haven't heard from?
Thank you. Does the president have doubts about the way the death toll is being calculated? Does he think perhaps the true toll is lower?
So the president answered this, and he said no, just a few moments ago in the Oval Office. On the mortality rate, I would note, as I noted just a few moments ago, we have one of the lowest in the world mortality rates. It's because of the hard work of the American people. Our mortality rate, is currently 218 per million. You compare that to Spain's at 548 per million, Italy at 485 per million. This country is in a place where, because of the work of the American people, we have escaped that 2.2 million number because of the extraordinary social distancing effort put in place by the American people. Yeah, way in the back.
Thank you. The president has said many times that he's received praise in phone calls with foreign leaders because of this administration's response to the coronavirus outbreak. Who exactly are those heads of state and heads of government who are praising this administration for its response?
Well, I won't reveal any contents of his private conversations with world leaders, but I will certainly share some of the very public comments from Democrat governors like Gavin Newsom, who said every single direct request that President Trump, that he was given, President Trump was capable of meeting. He has met them. Governor Phil Murphy, Democrat from New Jersey, the president knows New Jersey. He and his team have been extremely responsive in our hour of need, whether it was ventilators. We got a huge amount of supplies to test, and of course, I love the ones from Governor Andrew Cuomo, who praised this administration's response as phenomenal, saying he's delivered for New York. The Army Corps of Engineers, we built thousands of beds. He sent the Navy ship Comfort to New York. He has delivered for New York. President Trump has delivered for this nation.
Thanks, Katie. The president was talking earlier about Dr. Bright being a disgruntled employee. One of the allegations in that whistleblower complaint is that in January, when there was still a huge shortage of N95 masks, that he had been in contact with a company that was offering up to 1 million of those masks, and he couldn't get anybody at HHS willing to engage with that company, which then subsequently exported 1 million N95s to China. Is that something that you're looking into or concerned about?
Look, on issues of Dr. Bright, I'd refer you to HHS. I'm not going to get involved with the personnel issues or the substance of that complaint, but I will once again note, you mentioned masks, 70 million plus delivered, and again, that's 3 times the amount used by healthcare providers in any given year. So we've done a rather good job when it comes to supplies.
Back to the question about teachers and what the president said earlier about keeping those who are 60 or older out of the classroom. What is the message to older Americans? Should they not do anything, not leave their homes until there is a vaccine? Or what would the president have them do if they're not allowed to teach because of their age?
Well, our task force has said that vulnerable communities like our seniors should shelter in place. That being said, we encourage every American, if you have a symptom that is pressing, that you need to go to your doctor. I've been disturbed to read many quotes from doctors, stories of people who are staying home with chest pain and don't go to the hospital when they could be on the verge of having a heart attack, who are missing important appointments like mammograms, screenings like colonoscopies. It's important that we as Americans continue to go to our doctors to get medically necessary procedures, and when we have symptoms that need to be addressing, like chest pain, that you do go to your doctor. So if seniors need to go to their doctors, make sure to call your healthcare provider, go see your healthcare provider, go to the hospital should you have a symptom like that. Chanel?
Thank you, Secretary McEnany. Going back to a topic about the House in a separate chamber, Acting DNI Rick Grinnell has stated this week that he is prepared to release about 6,000 pages worth of transcripts relating to Adam Schiff's probe. Can you confirm whether or not the executive branch is conducting any kind of investigation into House members for potentials of wrongdoing, or is that something you can comment on yet?
Yeah, I don't have any information on that subject matter. That's the first time hearing of that.
If I can just go back to Jeff's question about Dr. Fauci and then the president's statement that there are too many Trump haters in the House. I mean, does the White House really believe that you can decide to have officials testify in the Republican-controlled Senate but not testify in the Democratic-controlled House? Doesn't the House have legitimate oversight and a legitimate really responsibility, not just the authority, but responsibility to have somebody like Anthony Fauci testify?
Will Dr. Fauci be questioned by Democrats in that Senate hearing?
Yes, he will be. So why? But are you saying that so the Senate's fine, the House has no role in oversight?
The House needs to act in good faith. We don't have time in the middle of a pandemic for publicity stunts. It's not the time for that. It's not the place for that. In the course of 3 phone calls, you should be able to give the subject matter to ensure it's the best use of Dr. Fauci's time. As you yourself noted, in the Republican-controlled Senate, Dr. Fauci will indeed be asked questions by Democrats.
Is the subject matter a mystery? I mean,
Jeff?
Kaylee, in a previous life, before you were press secretary, you worked for the campaign, and you made a comment, I believe, on Fox, in which you said President Trump will not allow the coronavirus to come to this country. Given what has happened since then, obviously, would you like to take that back?
Well, first let me note, I was asked a question on Fox Business about the president's travel restrictions. I noted what was the intent behind those travel restrictions, which is we will not see the coronavirus come here. We will not see terrorism come here, referring to an earlier set of travel restrictions. I guess I would turn the question back on the media and ask similar questions. Does Vox want to take back that they proclaim that the coronavirus would not be a deadly pandemic? Does the Washington Post want to take back that they told Americans to get a grip, the flu is bigger than the coronavirus? Does the Washington Post likewise want to take back that our brains are causing us to exaggerate the threat of the coronavirus? Does the New York Times want to take back that fear of the virus may be spreading faster than the virus itself? Does NPR want to take back that the flu was a much bigger threat than the coronavirus? And finally, once again, the Washington Post, would they like to take back that the government should not respond aggressively to the coronavirus? I'll leave you with those questions, and maybe you'll have some answers in a few days. Yep.
Haley,
We'll
respectfully,
allow
Thank you very much.
just